missed you last month, but I did have to cancel. I was sick, obviously, the month before, and then that month I was still trying to catch up a whole lot. I recently just finished my continuing education in veterinary spinal manipulative therapy. Okay, so that means that now I am certified to essentially do manipulation on the spine, very similar to a human chiropractor for animals, and kind of play off of that nervous system. So what I'm planning on doing is, now that it's official and I've officially graduated, I am planning on trying to set up a session specifically talking about what that is, why would we want to do it, and the health benefits and everything for that. But I did want to take a minute and say that I was very sorry we had to cancel last month, but I was a bit overwhelmed, and especially being sick the previous month got me a little bit behind. But we have graduated, and so now we're going to move on and try to get back into the groove here. So what we wanted to do for this final Facebook Live for 2021 was we really wanted to address questions. So we asked you guys, what do you really want to know about? What were your big questions over the year of 2021? And so we did actually get quite a few really good questions. So before I dive into that, just kind of wanted to say thanks again for all of the questions. And it's not just on these types of events, but anytime you want to give us questions, I love questions. Especially ones that I get submitted ahead of time, because that lets me give you more complete answers, and I have a little bit of time to do some research into it in case it's, about some new topics or anything like that going on. So thank you for that. Okay, so let's go ahead. We're just going to dive in here. So these questions do kind of jump around a little bit. There's no complete underlying theme other than the fact that they all have to do with taking care of our pets. So it kind of ranges quite a bit. So we'll start with the first question that I got here, and it says how to handle special diet needs in a multi-cat home. For example, this person has one kitty cat who needs to go on a diet, two that just like to nibble a whole lot throughout the day, and one brand new kitten that obviously is going to need different nutritional requirements than our other kitties who are full-grown adult or need to lose a little bit of weight. So I actually kind of wrote this down here so that I would make sure I hit all of the important points. I have a little outline here for you. So to start, this is a pretty complicated household, right? So there's a lot of things going on. There's a lot of different ways that you could go about managing this to make sure that everybody gets what they need. My suggestion would be actually to switch to meal feeding everybody. So the advantages of meal feeding is that they're going to allow you to completely customize each cat's diet. Now, one of the big questions that originally you look at that and you go, wait, how can I meal feed a cat that likes to nibble all day? Well, learning to eat at mealtime is something that cats can actually pick up very easily. So our carnivores, our dogs, and our cats, they're naturally meal feeding animals, okay? So they don't constantly sit there and chew on little parts of mice all day long, right? So they're gonna hunt, they're gonna get a meal, and they're gonna be good for a little while. Our cats tend to like to be grazers, at least from what we see. I think that has a lot to do with the fact that they typically like to keep different hours than we do. So we're not really seeing when they decide to sit down and eat a meal unless we switch them to meal feeding. Naturally, cats are a little bit more on the nocturnal side than human beings, so their busiest times of the day, based off of their individual circadian rhythms, tend to be more dusk and then also early morning. So kind of in those gray light areas, when it would be historically easiest for them to catch mice. And so while they're not out catching mice when there are happy little indoor cats, that does tend to be the largest times of the day, that or in the dead of night. Some people talking their cats love to run around and knock things over. Okay, so they're very active while we're sleeping. So while we might get some grazers all throughout the day, I think that they even them, they do tend to sit down and have a meal, but it's usually probably while we're sleeping. So I've never had a problem taking a cat who likes to graze and getting them used to feeding them meals. So I'm not too worried about them figuring it out. So they'll figure out, oh, the food's here at this time, I think I'm going to eat now. So, but I think, like I said, that's going to be the simplest to make sure everybody gets exactly what they need. Biggest thing would be when placing the meals, you're going to have to kind of separate them out, right? So they don't just steal each other's food. You have one that scarfs down the food and then it goes and it steals the food from everybody else, and maybe that one likes to eat a little bit slower. So you do need to kind of separate them out a lot of times. Probably your dieter is going to be the one that you're going to want to put in a different room so that he doesn't go bully everybody else, because he's probably going to eat the fastest. There's a reason that cats like to get a little bit on the hefty side. They really like their food. And then also with your kitten, this is going to allow you to feed a specific kitten food. So what's the big difference between adult cat food and kitten food? Adult cat food has a lot less calcium, phosphorus, and a lot less calories per scoop in it than your kitten food. So if kittens grow very, very quickly, we want to make sure that their bones have all the proper vitamins and minerals that they need in order to support that growth. And then also the calories, because it takes extra calories as well to grow that quickly. So we want to make sure that everybody is getting exactly what they need. So definitely want to give the kitten some kitty food, okay? And then as far as your dieter goes, there's a lot of over-the-counter weight management diets that you can grab. So it would be like, they usually say something about weight in the food title. So there's perfect weight, weight management, satiety, all those things. Satiety is just a fancy word for feeling full, okay? So the idea behind those is to have a fiber source or something in the food that's going to make your cat feel full or change the metabolism a little bit, things like that. So lots of different things you could grab for your dieter, but the biggest thing is measuring out the food for them so that they can't overeat, okay? And like I said, the nibblers, they're going to figure out how to eat at meal times, okay? They're not going to let themselves starve, and they'll be just fine. Some people really, really hate the idea of meal feeding. So with this complicated household, you can try leaving a food out all the time that has a little bit more of a complex carbohydrate, with the idea that our dieter will eat until they feel full, okay, and then they'll stop and they'll stay feeling full longer. So in theory, they'll overall eat less. But if our nibblers who don't need to be on a diet, they'll just keep on coming back to the food bowl because they actually need the calories. It's a great system in theory. A lot of our really overweight cats, a lot of them don't actually do what they're supposed to do with that. I think there's something with them, either psychological or metabolic, we'll never really know. They just don't ever really decide that, okay, I'm good, that's enough. The only diet I've really seen successful at this was, there's two of them. I haven't been able to find the one in a long time, but there was one out by Iams, and it was actually called Multi-Cat. And it was an Iams Multi-Cat. It had a complex carbohydrate source, and it would help overweight cats to lose weight. But, the thinner cats didn't become scary thin on it. And then also there's one out there with Royal Canin, and it's actually called Spayed and Neutered. So it's a diet specifically designed for spayed and neutered pets. Again, trying to play off of that satiety or that feeling of fullness so that they don't overeat. Having said that, you need to keep in mind that if you put out some of these diets with the idea that it's going to help your pet lose weight, they're going to eat it less quickly, okay? Because it's kind of the point, is they're feeling fuller, they're not going to overeat anymore. I know it can scare a lot of owners when you're used to having to fill the cat food bowl, every day or 2 or 3 times a day, depending. That you suddenly put the food in, and if it's one of those big feeders, you don't need to change it for several days, or you don't need to top it off for several days, depending on how big it is. That doesn't mean that your pet's not eating it ever. It just means they're eating it slower, which means that the food is actually working the way it's supposed to, because in order for your cat to lose weight, they do need to eat less. And so if they're just not feeling that hungry, that's actually a good thing. So try not to worry too much about that, because it is actually the idea of how these foods should work. Now, that could work for your nibblers and for your cat that needs to lose weight in theory, but that still wouldn't be very good for your kitten, because it's not going to get your kitten the calories that it needs. So you're still going to have to essentially meal feed at least the kitten. And so since we'd have to put at least one of them on a meal feeding thing in order to get the proper amount of calories, calcium, phosphorus, all that, it might just be easiest to go ahead and put everybody on meal feeding. So that's my suggestion of how I would handle that. There are lots of options. It is going to depend a lot on your individual lifestyle, what you think you can handle, what you think you can accommodate, all of that. So that for a really specific regimen, then you can always just give us a call and we can talk to you. But as kind of a basis for if I was placed with the idea of a multi-cat household like this, those would kind of be the two ways that I would go, with meal feeding being my first option for everybody, because we have to at least do some meal feeding anyway for the kitten, versus just, leaving it out and then meal feeding the kitten only. So something to keep in mind. Okay. Next question was, and this is a pretty good question for around the holidays here, are there any bones, like steak, ham, etc., that are okay for a dog to chew on? So cooked bones of any variety are not okay for dogs to chew on. Okay, cooked bones are the bones that are going to splinter. They're the ones that are going to crack. They're the ones that can be potential hazards for intestinal puncture or intestinal blockage, those types of things, because they're going to break apart, and sometimes they break in big chunks, sometimes they break in little chunks, and if they break into little pointy chunks, obviously that's not going to feel the greatest as it runs through the system. Now, raw bones tend to shave more than crack, right? So raw bones are pretty good. However, you need to get a raw bone that's big enough that your dog isn't going to get the idea to swallow it whole. Because if your dog decides to get the idea to swallow a raw bone whole, it's going to get stuck, and then you're going to have to see me for an emergency surgery, right? So how big does the bone need to be? Well, big enough your dog won't think about trying to swallow it whole. So for a Chihuahua, that's going to be a lot smaller than for like a Great Dane. Okay. My suggestion as far as that, if you really want to give your dog a bone to chew on, would be to go to a butcher and get like a big beef knuckle bone or something like that. Now, these bones are going to come with some meat essentially still on the bone, so it is going to be really messy. So I consider bones an outside chew toy because they're pretty messy, okay? But they do really love them. And then you just have to watch your dog too. The other danger with giving your dogs bones in general is if you have a dog that wants to try to use them like jawbreakers, they can fracture those teeth, okay? So that would, again, be another dog that I wouldn't give a bone to, okay? Because they're going to sit there and they're going to crack their teeth. And, slab fractures is the typical fracture that we'll see from dogs attempting to chew something that's too hard for them to chew, okay? So if you have a dog that is going to try to do that, watch out, because they're probably going to fracture their big molar back here with a slab fracture. And if that happens, it's going to be painful. You're probably going to see a little bit of blood in the mouth at some point if you happen to be around when it first happens, but the body's really good at stopping that blood. Or you might come in and see me and go, oh, he's got horrible breath. Well, it's because he's got a slab fracture on his tooth and now it's infected. So if we see those slab fractures with those exposed pulp cavities, we are going to recommend removing that tooth because it is going to get infected. And if you wait until that tooth's infected and the infection's been there for a little while, then it can start to affect the other teeth around it. So then as opposed to getting one tooth removed, then we end up needing to pull, 3 or 4, and it just turns into a mess. So just watch that, okay? So do I think bones are bad? Do I think they never have a place? No, I don't think that. In fact, dogs who can responsibly chew on bones tend to have the best looking teeth of any dog that walks in my clinic, especially raw bones. If you watch them it's got a little bit of meat, a little bit of tendon left in it, they kind of run their teeth through it. It almost looks like and acts like floss. So it helps in a lot of ways. However, if, they're cracking on it, they're going to break their teeth. If you get one that's too small, they're going to try to swallow it whole. If you get a cooked bone, it's going to crunch up, and if it doesn't happen to crunch up small enough or it gets a sharp pointy end, it can get really bad as well. So I think that's why a lot of veterinarians try to avoid the bone talk and just tell people don't give your dog bones. But if you get an appropriate sized bone, you get a dog who isn't looking for a jawbreaker, they can be good for their overall health as well. So I say yes to bones with a whole lot of asterisks after it. Okay, so that's something to keep in mind. Sorry, my phone went off. I thought maybe we had a live question I was going to try to address. But as far as holiday bones, because we are coming up to a holiday, I would say no. I don't like them to get any of the bones or anything. And even if you're like, well, I have a really small dog, I don't think he'll crack my cooked bone. You could be surprised. But even beyond that, a lot of the bones that we use in our cooking, they get seasoned a whole lot. And it's those seasonings that can really upset dogs' GI tracts. So just kind of throwing that out there as a little bit of a cautionary tale. If you really want to give your dog something off the table, please put something on there specifically for them. Something that was not cooked with any spices, that was not glazed or marinated or anything like that. Okay, so spices that kind of really tear them up on the inside. All right. Next question, is a raw diet good for dogs and cats? So, I don't recommend feeding our dogs and cats raw diets as a course. Now, can I get, well, did I just talk about giving them a raw bone? Sure, sure. Outside. Okay, so it's not going to be in your house. As far as an overall diet goes, I don't think there's any particular health benefit to feeding a raw diet at all. But there is a very substantial and very real human health risk when you decide to feed a raw diet to your dog. Because handling the raw meats yourself, you get a large amount of exposure to the gut flora from the deceased animals, especially since, if you're feeding a full raw diet, you're supposed to be feeding them the intestines with some of those partially digested feed in there so that they get, essentially their fiber and their veggies and all of that they need. And so with that, from a human health side of things, you're going to get exposed to a whole lot of E. coli. You're going to get exposed to a whole lot of salmonella. And you're like, well, it's fine. I washed my hands. Well, okay, but everything that thing touched is also going to get all of that. And it's not going to magically go away from their food bowl. Okay? And then if the dog was a little bit of a messy eater, suddenly it's all over their face too. And then they're going to come rub on you and they're going to go rub on something else. So it's just a lot more exposure in general in the home to a lot of gut flora. Okay? And a lot of issues like that. If you decide you want to do a raw diet and you're just like, well, I'm just not going to give the GI tract. Well, then you do need to supplement, hopefully with some vegetables. And I would recommend cooking those vegetables to help your dog to digest them. So they do need a good fiber source. They do need all of that stuff as well. So you can't just feed them, straight chicken breast or straight steak or something like that. Okay, so we do need to make sure that the meal is balanced. And so you're going to have to incorporate other things as well, and vegetables and everything, particularly raw vegetables. The dogs really don't get anything out of them except fiber, and there's still a lot of good vitamins and minerals in our vegetables. So you're going to want to cook those anyway. So you might as well just throw the meat in a crock pot too, cook it all together, and then you can make an at-home diet. And if you are really interested in an at-home diet making, we do have a recipe here at the clinic. You're more than welcome to pick up. And biggest things is you want to make sure you have enough calcium. You want to make sure you have enough vitamins, minerals, all those trace elements and everything for our dogs or our cats. So lots kind of to unpack there. The one thing I did want to say is that, there are a lot of people out there who do feed raw diets to their pet and don't contract a huge number of illnesses. And honestly, I think this is more of a props or a statement to the cleanliness of our harvesting facilities for those animals that you are feeding to your pet raw or consuming yourself raw. There's a lot of people out there as well that consume a lot of meat and eggs and everything raw. And I think that that's actually more of a statement to the cleanliness and the ability of our harvesting facilities. So little shout out to them. You guys are doing a great job. It's quite impressive that people are able to do that and not die constantly from all of the bacteria and everything that it would get exposed to potentially if somebody even just slipped up slightly. Okay, so that's awesome. We have great cooling facilities. We have great harvesting facilities, and the people who work there are doing a wonderful job, which is proof because all these people are dying all the time from eating raw diets all the time or feeding their pets raw diets. So did want to give a little shout out to them. I still do not recommend it. I feel like you're asking to get a horrible infection, and it's just not worth it because there really isn't any big health benefit to your pet by feeding them a raw diet. Our dogs are domesticated. They even have a special enzyme to break down carbohydrates. So yeah, your dog can digest your bread about as well as you can. They're omnivores at this point. They are no longer really carnivores at all. Wolves don't have that enzyme. Okay, so that kind of shows you. Okay, they've been with us for a long time, and they're used to eating more of an omnivorous diet. Okay, so then now we're going to kind of jump quite a bit. Okay. The next question is quite long and it has several parts to it. So I'm going to read the whole question and then we're going to kind of break it down a little bit. So kind of switching topics completely. Here we go. It says, I understand that cats can get COVID, as in COVID-19, and it can't be transmitted to humans as well, as there is not a vaccine for cats. There is a vaccine for cows. What about dogs? Also, lately there has been news about zoo animals contracting it. Can COVID be transmitted from domestic animals to humans? Can COVID in zoo animals be transmitted to humans? Okay, so there's a lot of questions in here and a lot of things to kind of run through. So we're going to break it down. So we're going to start with the fact that this person understands that cats can get COVID and it can't be transmitted to humans. Okay, so first, yes, cats can contract COVID-19. It is typically extremely mild clinical presentation, and it often presents actually with more GI signs as opposed to the primarily respiratory signs that you see in people. Okay, so while cats can get it, it's usually not a life-threatening issue with cats, and I can't think of a single case that I've seen pop up, at least from my sources, where a cat has become deathly ill with COVID-19. Okay. You are also correct in the fact that cats cannot pass the infection back into humans, as they typically, while they contract the virus from their human caregivers, they don't create a large enough viral load inside their bodies to make them infectious back to humans. So you could potentially get your cat sick, but your cat is not going to be able to get you sick. And if you do get your cat sick, again, the viral load is really low, and so you tend not to see a huge amount of illness. They're going to be off for a few days or things like that. Okay. Where I really think the confusion is coming into play here is when they're talking about the vaccine statements. So there is no vaccine for any of our animal species with regards to COVID-19. Okay. There are a lot of combination vaccinations for dogs and cats and cows, and they do cover several coronaviruses and have covered various coronaviruses for a very long time. These vaccines really haven't changed since before I graduated, and that was a little while ago. So it's been this way for a long time. We've been vaccinating them for various coronaviruses for a long time, not for the COVID-19 coronavirus, however. The coronaviruses in these vaccines are also GI viruses. Okay, so usually if your pet is going to be getting one of the vaccine coronaviruses, it's a GI virus, and they're usually seen in like puppies or kittens or in cattle. I think they can get it older as well, but it's usually life-threatening in the calves. So yeah, we do vaccinate them for coronaviruses. There is no official COVID-19 vaccine for any of our animal species. As I'll kind of address it again when we get down to the part of the question where it talks about zoo animals. Have people given animal species one of the COVID-19 vaccines? The only ones that I've been able to find were them giving it to other primates. Okay, and I think they've also tried some of the tigers and things like that. As far as our domesticated animal species, as to my knowledge, we are not trying to vaccinate any of them against COVID-19. Okay. And then, so kind of using that to trail into the zoo animals contracting COVID-19, that is actually how we first discovered that cats could contract COVID-19. It was discovered quite a long time ago at this point now, but it was actually a tiger at a zoo whose keeper was sick with COVID-19, and it passed the virus to the tiger, to his charge. Okay, I don't remember exactly which zoo it was. There have been a lot of confirmed cases in zoos since then, so it would be difficult for me to track down exactly which zoo and exactly which zookeeper it was that they first did this, but that is what first got us looking at animals contracting it in our exotic felines, and then it kind of transferred over to all the felines. Okay, and so we've found that felines and ferrets and other primates, they can get it, but at least to my knowledge, it still doesn't really infect canines. They're finding the virus in a lot of other zoo animals, and it seems like there's going to be news things popping up with this animal, then this animal, then this animal. A lot of it kind of rolls back to with the dogs getting COVID-19, and everything I've seen says that they can't get it. So our canine species seems to be very safe. They can carry the virus though. Okay, so, and we've already, to kind of, let me stay on track. Okay, I don't want to get distracted here. So To kind of keep moving through the statements of this question, okay, we already kind of touched on the viral load in our domestic felines not being large enough to worry about for transmission back to us. And with that, I would say that they cannot directly transmit COVID-19 to humans. So can my cat give it to me directly? No. However, all of our pets can act as what's called a fomite, or a surface that can transport disease from one area to another. Okay, so for example, if I have COVID-19 and I sneeze on my dog, and then he goes and he walks over to my cousin who loves dogs and smashes his face into my dog's coat in the exact same spot where I just sneezed on him, I gave my cousin COVID-19, okay? Or did my dog give my cousin COVID-19? Because I didn't directly sneeze on my cousin, however, my dog carried my sneeze over to him. Okay, so that's a fomite. So think of it the same way it would work is like dirty doorknobs spreading illnesses. That's why everyone's like, oh, wipe the doorknob with disinfectant, things like that. So they can act like fomites. They can carry the virus. If they, like I said, as far as my knowledge goes, dogs don't actually get actively infected with it at all. Cats can get infected with it, but it's really mild. And at this point, none of them, even if they do get it, seem to be able to directly give it back to us, just because they don't have that viral load. However, fomites can be in any way, shape, or form. So viruses do live on the surface of things for a time, and so if those things that they're living on happen to have legs, they can travel from one area to another. So that is something to keep in mind. And then to kind of go back to the zoo animals a little bit, we had a few questions at the end about those. As far as I know at this point, our feline zoo animals, or our cat species of zoo animals, don't seem to create enough viral load to come back to us, kind of the same as our domestic cats. I haven't seen anything that says different to that. The area of greater concern, I would say, would be the primates in zoos, such as apes and those contracting COVID-19. And I haven't personally seen information about whether or not they have a high enough viral load to pass the virus back to us. But with those, I would be way more cautious when working with COVID-19 positive primates. Now, I don't personally work with primates. I'm not personally a zoo veterinarian. I can try to reach out with my contacts to see if I can get in touch with a zoo veterinarian and try to get their take on it. I didn't have time to do that while I was prepping for this to see what their take was on the amount of zoo animals contracting and everything. But as far as, I would say, I'm highly suspicious personally of all of the species getting it, just because of all of the research that was done with dogs in the beginning, where it was eventually found that they can carry it, but that they don't actually get sick with it, or they'll be seropositive for it because they were exposed, but you're not going to really see any clinical illness with it, which goes back to the low viral load. Okay, so I would be very interested to see a little bit more information on that. Like I said, I wasn't able to reach out to any of my zoo colleagues, and when you attempt to research this, it comes up with a lot of information, and I'll be honest, I just didn't have time to kind of skim through all of it. From what I can skim through, I think that yes, they're finding a lot of it. I think there's a lot of exposure. My gut tells me it's probably more just surface area, maybe a little bit of seropositive. I haven't seen anything come through any of the veterinary channels that end up in my inbox, so this is something we need to worry about, or this is something that's popped up that we need to inform anybody of. So my guess is that it's still early stages research. You got a lot of people shooting off alarm bells that probably don't need to be shot off, and I wouldn't worry about it too much at this point. Okay. As far as your pets at home, since most of us aren't keeping tigers in our backyard, if you have COVID-19, I don't even recommend that you stay away from your kitty cat, okay? So if your cat does get it, it's going to be mild. I wouldn't worry about it, okay? So if them snuggling up to you, it helps you sleep at night, I wouldn't worry, okay? They're going to be just fine. I haven't met a cat or heard of a cat that got deathly ill from the virus. And again, they can't really pass it on to anybody else except as a fomite. So at this point, I would say that our animals are still pretty safe. So this kind of rolls us into our next question. from somebody else. They submitted a question that asked, can animals carry the virus that causes COVID-19 on their skin or fur? Yes, I kind of already went into that in a lot of great detail. But yes, absolutely. And I think that's the big risk when it comes to our animals and living in the house with us and spreading it to potentially other members of the household, things like that. So I hope that kind of covers that. If there's any area in there that you're not sure about or that you want me to cover with more detail, I'm more than happy to dwell back into it. If you want me to reach out to some zoo veterinarians to kind of look into those headlines a little bit more, I can. If you wouldn't mind just shooting me a message and asking me to do that. Otherwise, I'll probably just worry about it if it comes through the channels that I have. So as a veterinarian, as you know, an accredited veterinarian with the FDA and everything, usually if it's something that I need to worry about, it's going to show up in my inbox with a big red flag on it. And I haven't really seen anything like that running through. So now we're going to kind of come back to your basic welfare questions. And this one was, how often do my cats and dogs need to visit the vet? Okay, so this question has a lot of answers, as it really depends on the life stage and age of your pet. So to kind of go into it a little bit, very young animals, they need to come to the office about every 4 weeks until they're at least 16 weeks old. They need to do that to complete their booster set of their puppy kitten shots. Okay, so we like to get them vaccinated. We like to keep vaccinating them every 4 weeks until they're 16 weeks old, because that's when all the maternal antibodies get out of their system. And then your immune response is a fully mature immune system. You get that full immune response, and then you know that you're good for at least a year, okay, or 3 years, depending on the label on the vaccine. So depending also on your vaccine. Now, at 16 weeks of age, once your pet is like an adult by vaccination status, we still recommend yearly examinations, okay? Even if I give you a vaccine that's good for 3 years, it's still good to go get a yearly checkup. They have the same recommendation for people as well. It just kind of is going to let you make sure everything's kind of rolling smoothly, okay? And hopefully find problems before they become big problems. We want to find them still when they're just starting so that they're easy to nip in the butt, okay? Now, once your pet becomes geriatric, that's when we start to recommend kind of blood work along with your exam. And depending what's going on with that pet, you know, you might get a recommendation to come in every 6 months if there's an issue that we're worried about or that we really want to kind of monitor and see how everything's going, okay? So depending on what we find or don't find, the recommendation for how often does your pet need to come to the vet is going to vary quite a bit. So I know that's kind of clear as mud. If you have a question about your in particular pet, just give us a call. We'll probably start with an exam so that we can figure out exactly where they are and everything, and then kind of go from there. See if we need to see you back in a year, see if we need to see you back in a few months. Okay, we can also talk about blood work. I think we did one of these on wellness, and we kind of talked a little bit about wellness blood work at one point. We can always kind of dive back into that. What am I looking for? All of that stuff. But we could definitely do a further investigation to that as well, depending on exactly where the question is. But we do want to see them on a regular basis just to try to catch things again before they become big problems. So our last question that we got submitted was, do I need to worry about my pet's teeth? Okay, so in simple, yes. You do need to worry about your pet's teeth. Poor dental hygiene has been associated with an increase in respiratory infections, heart disease in humans for a really long time. And we're slowly starting to prove the same correlation in our domestic species. Okay, so our dogs and cats are living a whole lot longer, and we're starting to find that increased bacterial load from poor teeth in the bloodstream is starting to cause problems with their longer lifespan. So essentially, it's a good thing. Our pets are living long enough that their bad teeth are actually becoming a bit of a problem, okay? To give you a more complicated answer, because, there's subtlety into everything and nothing's black and white, you really only need to worry about your pet's teeth if you expect them to live long enough for the problem to affect them individually, okay? So what I mean by this is if your pet is already older, okay? A poor candidate for anesthesia, and it doesn't seem to be bothered by their horribly infected teeth, I'm going to tell you not to worry about it. At that point, something else will probably wear out first or be the end of them, so to speak, before their teeth is going to cause them to stop eating, or and the anesthesia of it could put them kind of over the edge. So if internally, if they're compensating in a lot of ways, and then we stress the system with an anesthetic episode, their internal organs, they've been feeling the strain of their years, and then it's just the straw that breaks the camel's back, so to speak. Okay, so it would essentially end up shortening their lifespan as opposed to lengthening it. Okay, when the decision really gets tricky, okay, what do I do with my pet's teeth, is when your pet is already older, has issues, is a really poor candidate for anesthesia, and has horrible teeth that's causing them pain, and they no longer want to eat now. Okay, at this point, you kind of need to weigh your individual risks. Okay, you need to decide ethically and financially, okay, whether you should try management, treatment, or just say goodbye. Okay, and it's hard because in these types of situations, there is not a correct answer, and there's also not a wrong answer. So this tends to be a really kind of a longer discussion between me and the owner about what we feel is going to be best for this individual patient after the evaluation and everything. And, you know, like I said, there really is no right, there really is no wrong, which makes that decision probably one of the hardest to decide how you're going to go about trying to manage this. So that's when the decision gets kind of tricky. But to kind of sum up and wrap up my opinions when it comes to teeth, I would encourage everybody to worry about their dog's teeth from a young age, so that I don't have to end up with that complicated, often quite heart-wrenching decision of whether or not your dog's too old to attempt to allow them to eat comfortably with their old age. Okay, so how do I worry about my dog's teeth from a young age? Well, you can come see us, and we're more than happy to look at their teeth. Chews that they actually chew on are good for teeth. Okay, teeth brushing with a soft bristled toothbrush using doggy safe toothpaste, which means it doesn't have fluoride in it, so it's safe to eat, is very good for your health. And then it'll also help, it has a little bit of a benefit, it'll help with that infamous dog breath. Okay, so what dog breath is it's the smell of infected teeth or tooth root abscesses a lot of the time. So it's horrible smelling. You don't really want that up in your face anyway. So owners who worry about their dog's teeth from a young age get really proactive with it. I love it because it lets them snuggle with their pets a whole lot longer. Their pets eat really good throughout their whole life, and then I don't have to do the whole, well, I don't know if it's worth it, you know, kind of one of those conversations. Okay, so I would definitely recommend that you worry about your pet's teeth from a young age. If they're already older, they're already aged, then that's when things start to get a little bit complicated. So that would be when, you know, we could have a conversation individually about your pet's teeth. But if you want, you know, from a young age to do all the preventative things to give them the happiest, healthiest, longest life possible, teeth really does need to be in there as well. We do see a lot of problems with teeth. All right, so those were all the questions that we got submitted. I really appreciate everybody who submitted questions. Hopefully that answers a lot of questions that other people had as well. Kind of covered a lot of topics. Like I said, we were kind of jumping around all over the place, but I think that it was still a lot of really good questions, a lot of areas of pet health that we definitely got to address there. So just to kind of wrap everything up, again, I want to say thank you to everybody working at the Carrollton Animal Hospital, especially Dr. Klein and Dr. Gardner. They covered for me a whole lot while I was studying this fall, and allowed me to further my education so I can help you guys out more. Like I said, we're going to be talking more about the new services that we're going to be providing here. We're going to be talking about that next month a lot. And then let me make sure there's any other things I need to talk about. So the new year is coming up, so I'm just going to give everybody a little heads up that the drug companies increase their prices next year, we're going to have to increase our prices next year. It's just one of those things that happens. They like to do it every year, keep up with inflation, keep up with production costs, and, you know, all of that. And while I was hoping that our shipping issues would go away, by this time we're still having shipping issues. So by that note, I'll also reach out and apologize to all of my owners who are currently giving their dogs Vetmedin, which is a pill that has been extremely hard to get a hold of, and we're getting it in any form that we can. So when you come to fill your Vetmedin prescription, yes, it might be in capsules this month and it was in tablets last month. We're doing the very best we can. We're getting what we can when we can to try to keep your pets as healthy and happy as possible. So, and then also shout out to all my owners who are feeding prescription food. It's running into a lot of the same issues. Sometimes they're on backward. You get a big bag, you get a little bag, you get cans. So we're doing our best. We're giving what they give us, and we're trying to keep it in stock for you guys so that we can keep everybody as healthy as possible. So just kind of bear with us. But that does kind of lead into, yes, prices will probably be going up next month, so just kind of bear that in mind. Next month's theme is going to be cold weather care, so we will definitely touch on that. Like I said, we'll probably do like an extra special little, either probably not maybe a live one, but maybe like another session we'll post up there about spinal manipulation. So that should be a lot of fun. Also, you can look up all of our past blogs and videos. We do have a TikTok channel. We've got some cute photos and videos on there and a lot of other things. And then always check out our online pharmacy. It's very warm right now, and it looks like it's going to be a muddy Christmas around here. But if the roads do turn down in January or February, the online store is a really nice way to get your stuff that you need shipped straight to you, so you don't need to go drive. So with that, I'll wish everybody a good night and a very Merry Christmas or a Happy Holidays, however you choose. And I'll see you next month. Next year, actually.